Hey there, welcome to my channel. Today, we're going to be talking about a serious medical condition that affects millions of people worldwide. Myocardial infarction, also known as a heart attack. Myocardial infarction is a medical emergency that occurs when blood flow to a part of the heart is blocked, resulting in damage to the heart muscle. It's a leading cause of death and disability worldwide, and it's essential that we understand its causes, symptoms, and treatment options. In this video, we're going to cover everything you need to know about myocardial infarction, including its causes, risk factors, symptoms, diagnosis, treatment, and prevention. We'll also discuss the complications that can arise from this condition and how you can reduce your risk of developing it. So, whether you're someone who has been diagnosed with myocardial infarction, someone who is at risk of developing it, or someone who wants to learn more about this condition, this video is for you. Let's get started. Now that we know what we're going to cover, let's dive into the causes and risk factors of myocardial infarction. Myocardial infarction is usually caused by a buildup of fatty deposits, also known as plaque, in the walls of the arteries that supply blood to the heart. Over time, this plaque can cause the arteries to narrow and become blocked, leading to a heart attack. There are several risk factors that can increase your likelihood of developing myocardial infarction. Some of these risk factors are modifiable, which means you can take steps to reduce your risk, while others are non-modifiable and cannot be changed. Modifiable risk factors include high blood pressure, high cholesterol levels, smoking, diabetes, obesity, lack of physical activity, unhealthy diet, stress. Non-modifiable risk factors include age, men over 45 and women over 55, family history of heart disease, gender, men are more likely to develop myocardial infarction than women. It's important to note that having one or more risk factors doesn't necessarily mean you will develop myocardial infarction, but it does increase your risk. By making lifestyle changes and managing underlying conditions, you can significantly reduce your risk of developing this condition. Next, we'll discuss the symptoms and signs of myocardial infarction. The symptoms of myocardial infarction can vary from person to person, and some people may not experience any symptoms at all. However, the most common symptom of myocardial infarction is chest pain or discomfort. This pain can be described as a tightness, pressure, or squeezing sensation in the chest that may last for a few minutes or longer. Other symptoms of myocardial infarction may include shortness of breath, fatigue, dizziness or lightheadedness, nausea or vomiting, pain or discomfort in other areas of the body, such as the arms, back, neck, jaw, or stomach. It's important to note that not all people who have myocardial infarction will experience chest pain or discomfort. Women, in particular, may be more likely to experience other symptoms, such as shortness of breath, nausea, or back pain. If you experience any of these symptoms, it's essential to seek medical attention right away. Delaying treatment can lead to serious complications, such as heart failure or even death. Next, we'll discuss how myocardial infarction is diagnosed. Diagnosing myocardial infarction typically involves a combination of medical history, physical exam, and diagnostic tests. The most common test used to diagnose myocardial infarction is an electrocardiogram, ECG. This test records the electrical activity of the heart and can show if there is damage to the heart muscle. Other diagnostic tests may include blood tests to check for certain enzymes or proteins that are released when the heart is damaged. Imaging tests, such as echocardiogram, cardiac CT scan, or cardiac MRI, to assess the heart's structure and function. Angiogram to examine the blood vessels in the heart and determine if there is a blockage. The treatment and management of myocardial infarction depend on the severity of the condition and the individual's overall health. The main goal of treatment is to restore blood flow to the heart as quickly as possible to prevent further damage to the heart muscle. Treatment options for myocardial infarction may include medications, such as antiplatelet agents, anticoagulants, beta blockers, or nitroglycerin, to improve blood flow to the heart and prevent blood clots. Percutaneous coronary intervention, PCI, or coronary artery bypass grafting, CABG, to restore blood flow to the heart in severe cases. Lifestyle modifications, such as adopting a healthy diet, regular exercise, quitting smoking, and managing underlying conditions like high blood pressure and diabetes. In addition to medical treatment, it's essential to make lifestyle changes to reduce the risk of developing myocardial infarction or having a recurrence. This may include eating a healthy diet, getting regular exercise, maintaining a healthy weight, quitting smoking, and managing stress. Next, we'll discuss the complications that can arise from myocardial infarction. Complications can arise from myocardial infarction, especially if it's left untreated or if treatment is delayed. Some of the most common complications include arrhythmias, which are abnormal heart rhythms that can be life-threatening. Heart failure, which is a condition where the heart can't pump blood effectively. Cardiogenic shock, which is a life-threatening condition where the heart can't pump enough blood to the body. Sudden cardiac arrest, which is a sudden loss of heart function that can be fatal. If you've had myocardial infarction, it's essential to follow your healthcare provider's recommendations and attend regular follow-up appointments to monitor your heart's function and manage any underlying conditions. Preventing myocardial infarction involves managing your risk factors and adopting a healthy lifestyle. Some of the most effective ways to prevent myocardial infarction include quitting smoking, eating a healthy diet that's low in saturated and trans fats, cholesterol, and sodium, getting regular exercise and maintaining a healthy weight, managing underlying conditions, such as high blood pressure, high cholesterol, and diabetes, reducing stress levels and getting enough sleep, attending regular medical checkups to monitor your overall health and manage any underlying conditions. By taking these steps, you can significantly reduce your risk of developing myocardial infarction and other heart-related conditions. To sum up, myocardial infarction is a serious medical condition that requires prompt medical attention. By recognizing the symptoms and risk factors, seeking timely medical care, and adopting a healthy lifestyle, you can reduce your risk of developing this condition and live a healthier life.